Hello and welcome to the weekly COVID-19 report from the city of Fredericksburg. Let's talk a little bit about the numbers. The numbers continue to drop, and that is a good sign for those that are worried about the COVID environment in the greater Rappahannock and Fredericksburg area. The percent positivity on the 7-day average is now down to 12.3% as of yesterday, and that includes those reported over the President's Day holiday, so that is a good sign. Total number of hospitalizations is also bouncing in the 40s to 50 range, so that is good through all the 3 hospitals that we have in the health district, so that's a good sign there. The number average per week and per day is coming down as well, so that's also a positive sign in the fact that the Omicron variant has peaked at this point. There is another version of Omicron out there. We're yet to see whether that's going to make a major push or it's just going to dwindle off at this point. But right now, the primary Omicron is starting to dwindle down a little bit, and health districts are getting better with the amount of COVID that is out there in the environment. So those are all positive signs that things are starting to get better and move toward what may be a new normal. But we're starting to get better. So let's talk about some things. If you feel that you have COVID-19, please stay home and try to isolate yourself from your loved ones, or if you can stay by yourself, that's great. If you need a PCR test, remember the community testing center that was at Fred Nats Park has closed. That is no longer open, so please don't go there for a COVID test. But if you need COVID tests, you can either go to your primary care physician, you can go to an urgent care clinic, you can make an appointment with one of the local pharmacies to get a testing done. They're not as hard to get as they used to be because of the amount of testing that's being done. Or if you need to go to one of the community events, every Wednesday afternoon at the Stafford Hospital Center, 101 Hospital Boulevard up in Stafford Courthouse is available. And then this Friday, the 25th of February, they'll be at the Ladysmith Rescue Squad, again, 3 to 5 p.m. at the Ladysmith Rescue Squad. That's on Jefferson Davis Highway in Ruther Glen, or just below the intersection there at Ladysmith. So if you need testing events, that's where you can get testing. The community vaccination clinic is still open, so if you need to get a vaccine for COVID, you need to get a booster or you need to start the primary series of shots, that's available. That's 1877 Carl D. Silver Parkway. That's open every day, Monday through Saturday, and just check for their hours. You do not need an appointment. You can just go there to do that, so I think that'll be fine as well if you need to get a vaccination. But the numbers are looking better, the percent positivity coming down, and all those are good signs. So let's go over a couple of more things. What is the safest way to prevent you from getting COVID-19 if you feel that you are going to be exposed or potentially in an area? And the easiest thing to do is get vaccinated. Pure and simple that. If you've already got the vaccination or if you're eligible for a booster, that's fine. If you've gotten vaccinated and had the booster, you're considered fully vaccinated, that's great. Things like that. CDC at this point still recommends mask wearing, especially in public indoor spaces. So that hasn't gone away yet. It may well go away soon, but right now we're still recommending the mask be worn in public indoor spaces based off of CDC guidelines and the fact that all 5 jurisdictions in the Rappahannock region are still considered high in the transmission level, and that would be the key to wearing masks in public indoor spaces. So I think that's important as well. Some other things to consider about COVID-19 and the potential spread. Do you have young children in your household? Have you been able to get them vaccinated? They're putting the pause a little bit on the vaccination for the younger folks, but can you get that done? Do you want to do that with your children? Again, that's an individual preference. Things like that. Do you have anybody in your household that lives in your household or that you see on a regular basis that is immunocompromised and they have underlying conditions like diabetes or heart disease or lung issues or things like that? Those are all good reasons to try to prevent COVID-19, and the best way there again is a vaccination to try to do that. So there are all types of things that are going on out there. Things are looking better in the community. We're going to keep you updated with our reports as much as we can, either in the written or the video form, and we'll talk again soon. Thank you.